My message as a person who's had vaccination and developed COVID after that is vaccines do work. I've just had mild disease and hopefully I'll be through with it in a couple of days.
That's a very important message, because people have been feeling that if they're hearing stories about someone who's taken the vaccine, has taken a single dose and then gotten sick, and then wondering then what's the point, etc. There is a point, because it does protect you from severe disease, and there is more protection from death, which is what is important right now. So as soon as you get the opportunity, you should take the vaccine. Before I come to Dr. Shashank Joshi, who was also in that meeting with the Prime Minister today, I just want to take you through some of this vaccine mathematics. Now, this is a report BofA Securities put out earlier today, Bank of America Securities put out earlier today, which talked about how the current capacity in India is 75 million doses per month, which is expected to expand by 50% from July. Serum Institute of India accounts for 91% of the vaccines that we're giving right now. Dr. Reddy's will import 250 million doses of Sputnik this quarter. And the ramp up is expected to go like this. Serum Institute will ramp up to 100 million by June. Bharat Biotech will ramp up to 12 million by July. Now, this is the interesting part. They've given us 3 scenarios. And the best case scenario, the bull scenario they talk about, is that we can end up vaccinating 48% of the population by the end of 2021. The worst case scenario is that we are stuck with 34% of the population. Dr. Shashank Joshi, how important is it to reach this best case scenario? What can you tell us about the important points that were made in that meeting with the Prime Minister today?
First of all, Tamanna, I think the opening up of vaccination is a big boost to the whole country, and it will generate more vaccine confidence. And particularly in the second wave, which is predominantly seeing these people between 18 and 45 being particularly affected. It's a very rapidly swarming strain, which is almost hit like a tsunami-like proportions. So that's something very clear. And I think we need to ensure that maximum people, and also there has been some degree of decentralization, and there has been an equitable distribution. Central will keep 50%, another 50% states as well as private players can enter. So I think there has been a fair amount of liberty given. Also, we are looking forward to many more fast-track approvals of vaccines, like the Johnson & Johnson vaccine, maybe Moderna and Pfizer also coming into place. And therefore, there will be a larger choice in the milieu of vaccinations in people who can access or afford it. At the same time, people who can't access and afford it also, they have been kept in mind, and they will also get the vaccinations. So I think the vaccine hesitancy should be stopped, and we should embrace it. Beyond that, of course, Honorable Prime Minister is concerned about the current grim situation prevailing across the country, but he's very confident, and he was very sensitive to what Dr. Jailal said as the president of IMA, representing the entire medical community, because we can build a lot of infrastructure, we can get oxygen, we can get medicines, we can get vaccines, but we can't get people. And how to generate the larger healthcare workforce is the biggest challenge which the healthcare community is facing. And that's why, he's ensuring that we have to be positive and proactive, and various measures will be adopted. And all the suggestions were taken in a very positive note. And I am certain that under the leadership of the Central Ministry of Health, which is very, very proactive, with Dr. Vinod Paul from Niti Aayog as well joining in, they will take some very proper cogent measures so that we can break this chain of this current tsunami which we are seeing. And with some appropriate restrictions and containment measures, we will be able to come around it. As you can see now, Mumbai, Pune already are showing some signs of plateauing. And so, of course, it's a long way to go for this current wave, but I'm reasonably certain that we'll be able to break the chain in a very positive manner. And also, the triaging of cases, ensuring that most eligible people get the bed.
If I just may ask you... I just want to get a take from you on vaccine, because you're on the Maharashtra task force, and now with this notification, it's been left to the states to decide who they want to vaccinate first. Now, from the 1st of May, going by the current capacities, etc., it's clear that there will not be a huge abundance of vaccines. There's 50% of the capacity which will be distributed among the states to do with it as they see fit. So states themselves will first have to go out and procure the vaccines as per availability from these manufacturers, because the central government will continue vaccinating only those 45 and above in government hospitals for free, as they have been doing. But the state governments will have to go and procure the vaccines, see how many they have, and then decide who to give it to. Here, what do you think should be the priority for a state like Maharashtra, which has the maximum number of cases? Can we open up en masse to everyone above 18 from the 1st of May, or will there be a further dissection of, which categories need to go first?
So I think very clearly inputs from public health experts will be taken. And I think currently, even now, the first strategy is to save lives. And in the Save Lives strategy, first is to ensure that all are vaccinated who are in the eligible group above 45. And below 45, all those who have comorbidities will get a priority. Because people who have comorbidities below 45 are more vulnerable to death. So first thing is save lives. I think that is going to be very, very clear. Independent of the state or the center, everybody is on unanimity here that in a very calibrated, systematic way, first thing is the most vulnerable ones who are likely to lose their lives will be vaccinated first. And the whole idea is to vaccinate people above 45 as fast and as early as possible. So this also allows a mechanism for the state, at least in the less exposed geographies. See, there are populations within the state which are heavily exposed to the virus, and there are populations within the state which are less exposed to the virus. We have seen in this wave, the less exposed population is the one which was vulnerable and caught the virus. And then that spread like a tsunami. So it is ensuring that we have to ensure that these seronegatives within the states are the ones who would be targeted. So each state and district-wise, there will be a strategy which will be decided in a scientific basis. So here, a proper scientific rationale will be put in place by each state, each district, and the most eligible and the most deserving will be vaccinated. But also, a opening has been made for people between 18 to 45, because remember, these are the most productive people. They are also running our economic engine. And therefore, workplaces also have been permitted now. A couple of days back, we have to congratulate a decision of the central government that they have allowed vaccinations to be done at the workplaces. And therefore, lot of workforce which is there at the population, which is likely to get infected, they will also get vaccinated. And lot of people who are between 18 to 45 in that workplaces, the people who are having those corporates, they will be able to buy the vaccines from the private sector and vaccinate their population. So I think it is a very appropriate gesture, and I am certain that it will be used in a very judicious, appropriate way so that the maximum possible protection is conferred in that geography and that population.
I want to talk a bit about what this judicious way would be. And Ms. Reddy, I want your thoughts over here. Do you agree with Dr. Joshi that first, the next in line ideally should be those below 45 with comorbidities? How will we ensure that this is, properly distributed, because states will now have that responsibility. Private companies will also tie up with vaccine manufacturers. And do you think there is a case for concentration of vaccination in areas where there is higher infection?
So I think the best way for us to look at it is first, look at the population which we have. There's a certain group, as he said, which are seronegative. You might want to really pick up that population and vaccinate them. The other group are the ones who are, either handling elders or living with older generations, because, then it makes them more vulnerable. So those are the groups, again, which are the target population. But the permission to really go to workplaces and vaccinate that population, whether, it's large employers, it's large corporations, I think will make a huge difference, because then you've taken care of a certain population, which is, again, a targeted group. So literally you can't boil the ocean, but we need to pick up target groups who to us will either be the most vulnerable or the spreaders of the disease. I think you need to look at both of them, target this population, do it as quick as possible, and that's probably the fastest and the most sensible way to handle this. Again,